Hi everyone, I am Dr. Pradhan and welcome to my channel Dr. Pradhan Health Tips. Hopefully you all are doing well. Today I will discuss about acid reflux disease. It is also known as gastroesophageal reflux disease. This is such a very common disorder that every adult might have experienced at least once in their lifetime. So before that we should know slight about the anatomy. As you can see in the picture, esophagus or the food pipe connects with the stomach and the junction area is known as the lower esophageal sphincter. This is the area where acid reflux occurs. The lower esophageal sphincter prevents the acid reflux due to its high pressure. But if the lower esophageal sphincter pressure is decreased due to any reason, then there is backward flow of acid from stomach to esophagus. And this causes the symptoms of acid reflux disease. This is also known as heartburn. And if the symptoms occur more than twice per week, then it is called as acid reflux disease. Coming to the etiology or cause of acid reflux disease. First of all, after taking a heavy meal, if somebody is lying down, then that might cause acid reflux. Then smoking, alcohol. Alcohol not only increases the acid output, but also it relaxes the lower esophageal sphincter, which is the area where acid reflux occurs. The food items which increase the acid reflux are tea, coffee, carbonated beverage, citrus fruits like lemon, orange, grapefruits, then tomato sauce, other items like onion, garlic, deep fried foods, fast foods, fatty foods. These increase the acid reflux. Coming to the symptoms of acid reflux disease, there is burning type of chest discomfort which moves from stomach to chest. This is known as heartburn and regurgitation of bitter or sour like acid in our throat or mouth. Other symptoms of acid reflux disease are bloating, belching, hiccup, nausea, bad taste or bad breath. How will you diagnose a case of acid reflux disease? Barium swallow X-ray. This is a special X-ray procedure done to delineate the junction between esophagus and stomach. This is the area where acid reflux occurs. Then esophageal manometry, and third is endoscopy. So these are the investigations done to diagnose a case of acid reflux disease. How will you manage a case of acid reflux disease? We have to do some lifestyle changes like reduce weight, quit smoking, stop taking alcohol, then take adequate green vegetables like spinach, kale, and asparagus. Take some watery fruits like cucumber, watermelon, and alkaline fruits like banana, nuts, cauliflower can be taken. And milk is also a good option. It dilutes the acid. High fiber rich diet like brown rice and oatmeal should be taken. Take smaller meals more frequently than the heavier meals. And head end should be elevated while lying down. The night meal should be taken at least 2 to 3 hours before going to sleep. So these are the lifestyle changes we have to do so that we can prevent the acid reflux disease. Coming to the medications, H2 blockers like ranitidine, famotidine are given to reduce the acid output. PPI or proton pump inhibitors like omeprazole, rabeprazole, pantoprazole are given. Then prokinetics like metoclopramide are given to increase the LES pressure or lower esophageal sphincter pressure. This is all about the acid reflux disease or gastroesophageal reflux disease. Hopefully, you have liked the video and please share your comments so that I will make some better videos. Thank you so much.